My mom went into the hospital with a fever, and through some different tests that they did, it triggered pancreatitis, which they did not manage for over 24 hours. So it turned into a life-threatening pancreatitis. When I went to visit her the evening before she got transferred to the ICU, she was in clear respiratory distress. She needed to be intubated after she was unable to go on BiPAP ventilation, and was ventilated for 14 days during this severe sickness that she had. So she was in the medical ICU for a few weeks and battled lots of complications. So there's obviously a lot of care that needs to be done for someone that's intubated, and then after 14 days, the doctors said it would be best to perform a tracheostomy. When she got the tracheostomy, one of the nurses that was working with her emphasized to us as the family how important it was to have frequent suctioning to keep her as healthy as we can, and that the ramifications of not doing that could be catastrophic. Oral suctioning is very cumbersome and uncomfortable for patients. So with my mom, she typically had to be suctioned once an hour, and instruments that are used are very coarse, and our family was not comfortable suctioning her. We had been asked a few times by different nurses if we wanted to learn, and we just did not feel that we were qualified, as we're not medical professionals. When a patient becomes orally defensive, as my mom did throughout her stay, there is just a flat out refusal to open your mouth to get suction, despite hearing, I mean, we could hear the sounds of her struggling with the secretions in her mouth. But she was so frustrated and so sick of getting poked and prodded. But if she had something that was comfortable, then it certainly would have been a different scenario for her. My mom was an extraordinarily independent woman. She had to endure and really kind of trust and turn herself over to being completely dependent in this situation. So you have a woman that is very private and very dignified in her day-to-day life, and in this diabolical situation that she has found herself in, did not have a lot of opportunity to use her voice at all during the time that she was intubated and trached. And so for her, the inability to advocate for herself and the fact that she was covered in her saliva several times throughout this process was, I think, really demoralizing for her. You can't be at bedside, 24/7 with a patient when you have other patients to take care of. If there was a continuous suctioning device, then you don't have to worry as much about that. That peace of mind for us as her family would have been amazing, just to know that she would be safe and that she would be comfortable and that she would have that dignity that she did not get. So if my mom and other patients had the SWIK saliva system, which is extraordinarily soft, flexible, and discreet, it gives patients the dignity and respect that they deserve, and the peace of mind for not only the patient, but my family would have felt so much better having a system like this for my mom, and knowing that she would be taken care of, and that there would not be that constant pushing in her mouth and uncomfortability of the oral defensiveness that she had from the other systems. She would have had a much better quality of life during her ICU stay than she had because of this device. There are ways that we can do better for patients and for our loved ones, and having something like that SWIK system would just make such a difference for patients like my mom.